This, 1 in 6 healthcare and social service workers, 3.1 million out of 18.7 million, are immigrants. These immigrants are playing a critical role in the battle against the pandemic, and yet our broken immigration system does not allow many of them to fulfill their dreams of becoming part of America's future. I've come to the floor today to tell a story of one of our immigrant health heroes, and I'll continue to highlight these stories in the coming weeks. I'm also inviting my colleagues from across the nation to come tell their own stories on social media or on the floor with hashtag Immigrant Health Heroes on this chart. Thousands of immigrant health workers are suffering because of a serious problem in our immigration system. It's the green card backlog. This backlog puts them and their families at risk of losing their immigration status, and it hinders their ability to participate in the fight against COVID-19. Under our current laws, there are not nearly enough immigrant visas, also known as green cards, available each year. As a result, immigrants are stuck in crippling backlogs, not just for years, but for decades. Close to 5 million future Americans are in line waiting for green cards. Hundreds of thousands of them are already working in the United States on temporary visas, while many more are waiting abroad, separated from their American families. Only 226,000 family green cards and 140,000 employment green cards are available each year. The backlogs are really hard on these families who are caught in this immigration limbo. For example, children in many of these families age out and face deportation as their parents are waiting in line for their green cards. The green card backlog includes thousands of doctors, medical doctors, who are currently working in our country on a temporary basis. These doctors face many restrictions due to their temporary status, such as not being able to volunteer at hospitals in COVID-19 hotspots where they are so desperately needed. The solution to the green card backlog is clear: increase the number. In 2013, I joined a group of 4 Republicans and 4 Democrats who authored a bipartisan, comprehensive immigration reform bill. The bill passed the Senate with a strong vote, 68 to 32, and it would have eliminated the green card backlog. Last year, I introduced the Relief Act, legislation based on the 2013 Comprehensive Immigration Reform Bill that would clear the backlog for all immigrants waiting in line for green cards within 5 years. I'll keep fighting to help all immigrants who are stuck in this backlog. Last week, I joined with my colleagues, Republican Senators David Perdue of Georgia, Todd Young of Indiana, John Cornyn of Texas, and Democratic Senators Chris Coons of Delaware and Pat Leahy of Vermont to introduce legislation to quickly address the plight of immigrant doctors and nurses who are stuck in this green card backlog. This backlog poses a significant risk to our ability to effectively respond to this pandemic. Our bill, the Healthcare Workforce Resilience Act, is a temporary stopgap bill that will strengthen our healthcare workforce and improve healthcare access for Americans in the midst of this crisis. Our bill would recapture 25,000 unused immigrant visas for nurses and 15,000 unused visas for doctors. These are visas that Congress previously authorized, but we never used. Our bill would quickly allocate these visas to doctors and nurses who can help us today in the fight against COVID-19. It is important to note that our bill requires employers to attest that any immigrant from overseas who receives these visas will not displace an American worker. We want to ensure that all beneficiaries of this bill complement our American healthcare workforce. As Congress begins to work on the next legislation to address this pandemic, I will push for the Healthcare Workforce Resilience Act to be included. Today, I want to tell you the story of one immigrant healthcare worker who is stuck in this green card backlog and would benefit from the act I just described. This is Dr. Ram Alur. Dr. Allure was born in India. As a child, he survived a bout with meningitis, a disease that is often fatal. This experience inspired him to become a doctor. He went to medical school in India, then trained in internal medicine in the United Kingdom. Dr. Allure came to the United States in 2007 for medical residency training. In 2011, he began working as an internist and hospitalist at the Marion Veterans Affairs Medical Center in Marion, Illinois. Dr. Allure has led the emergency room and inpatient unit for the last 3 years, and now he's on the front lines of a pandemic as a member of his hospital's COVID-19 response team. Dr. Allure lives in Marion with his wife and 3 kids. Their ages are 12, 8, and 6. He sent me a letter, and listen to what he said about his life in Southern Illinois, living in Marion. I consider the opportunity to work at the Veterans Administration Medical Center as a blessing. To serve the veterans is an honor, responsibility, and satisfaction that enhances anyone's life. I've found my calling and hope to spend the rest of my career and raise my family here. I would like to see my children blossom in this community and grow into successful, responsible citizens. Unfortunately, Dr. Allure is one of thousands of doctors stuck in this green card backlog. He's been forced to renew his temporary visa 4 times since he started working serving our veterans at the Marion VA facility. He's been approved for a green card, but will have to wait decades because of the backlog of people just like him waiting for their green cards. In the meantime, Dr. Allure's oldest daughter would age out. She's 12 now, but she would age out and be forced to leave the country before he is legally entitled to become a citizen of this country. Think of that. Heartbreaking situation, breaking up this man's family because he's been approved for a visa but has to wait to make sure he meets the quota each year, and he'll end up waiting for decades. In the midst of this pandemic, Dr. Allure's immigration status puts him at a great risk. If, God forbid, he contracts COVID-19 and becomes disabled or dies, his family would lose their immigration status and be forced to leave the United States. Tell me that's fair, that this man who is serving our veterans, who's waiting patiently to become a citizen of the United States and be part of our future, should he get sick or die, his family would be deported. Here's what he said to me about this. The pandemic shook our family. Being a temporary worker on a visa never stared us in the face more. This lack of protection is every frontline immigrant doctor's nightmare. Dr. Allure's temporary immigration status also prevents him from working part-time in a COVID-19 hotspot like Chicago. Here's what he said. It's depressing to watch the medical system stretched while the pandemic takes its toll and not be able to help or participate. It's like a soldier sitting out a battle, a player sitting out a game, a fireman sitting out a house fire. His family's plight led Dr. Allure to start Physicians for American Healthcare Access, a nonprofit organization to advocate for doctors serving underserved communities who are stuck in this green card backlog. Madam President, I can tell you, in Southern Illinois, we are desperate for good doctors. We need them not just at Marion VA, but we need more specialists around the entire region. This is a rural area of our state, a small town area, and they need these specialists more than ever. How we could take a good man like this, who's willing to serve our veterans and do more in this COVID-19 epidemic, and tell him he's not welcome to be a citizen of this country, I just do not understand. When I heard Dr. Allure's story, it inspired me to work with my colleagues on a bipartisan basis to introduce this law that I've mentioned, the Healthcare Workforce Resilience Act. Under our bill, Dr. Allure and thousands like him could receive their green cards. They and their families would get permanent immigration status that they deserve and be able to use their skills to serve on the front lines of the pandemic if they are needed, and they are. I hope that even in these divided times, we can come together in Congress to quickly aid these immigrant healthcare heroes. Madam President, I'd like to make a separate statement placed in a separate part of the record with unanimous consent.
Without objection.
Take these down. Madam President, on Monday, in this season of great mourning, last Monday, America lost a man who had tried for years during some of our darkest moments to comfort our grief-stricken nation. His name was Greg Zannis, but he was known as the Cross Man. 1 month ago, he was diagnosed with terminal cancer. Last Friday, Mr. Zannis, his wife Sue, and their grown children watched from inside the Zannis family home in Aurora, Illinois, as a parade of neighbors drove past to show their love and respect for Greg. This caravan of caring stretched for a mile and included more than 320 cars, trucks, SUVs, and motorcycles.